So on the connected diagnostics side, there are a lot of areas that are very important to talk about. First of all, in order to deliver effective healthcare, we need greater linkages between diagnostic results and patients. Biometric identity at the patient level can help create unique records so that we can start counting patients as opposed to tests. Digital identity layer starts to connect siloed health platforms. Patient management can now be linked to lab systems, and we can link patient management in one clinic to patient management in another. And also that identity generated at the point of contact with the patient can now be critical to closing the loop with the patient. So this also one of the exciting areas about these technologies is that these technologies can be empowering both in terms of solving problems, but also helping us build systems that can address business needs, both operations and business needs. So on the operations side, we're all preparing for a digitization of all healthcare data, focused on aggregate data for analysis and individualization of healthcare treatments. Granular patient-level data sets are essential to developing decision support tools, point-of-care diagnostics, and other healthcare innovations. However, without unique patient identity, this is nearly impossible to achieve, particularly with the level of accuracy that we're seeking, such that any deployment of a dynamic clinical algorithm system requires unique patient identity to maximize the impact that the solution can have on clinical care of patients. The introduction of reliable patient recognition on the mobile devices that already proliferate the health ecosystem can help maximize the investments made in healthcare innovations like connected diagnostics and improvements to central data warehouses. As such, the digital identity layer can start to connect siloed health platforms. So this now lets us get down to business, which is that in many contexts, certainly in South Africa as well, we have both the need to understand how to solve a problem, but then how do we deliver this solution? And oftentimes the finance department is as important in terms of playing a role in that as the practitioners. So this is part of what's exciting, is that we can now leverage these modern technologies to help improve the business model of delivering health solutions to patients. So number one, really more operationally, we can link the patient to the medical record to accurately diagnose and treat them. Number two is that if we can help automate better the patient processing, the throughput of patients through the health system, the hospitals and clinics, then we can serve more patients on a given day. That can help drive revenue growth for more utilization per day. Cash conversion cycle. If we can automate patient event validation between a health provider and a health insurance company, can we help hospitals and clinics get paid faster by the insurance companies? Our company is involved in this with national health systems and national health insurance systems in a number of countries. It is quite common, for example, for insurers not to pay about 10% of the claims because it can be very difficult to validate if a health event actually happened. And in 3 countries that we're involved in, the incidences of fraud in health insurance payments could be 25–30%. In one country, the estimation of a health insurance company is it can be as high as 50%. And there's many different ways that happens. All of these become frictions in health system delivery. So if we can solve these with modern technologies, that helps everyone. And cost reduction. On both sides of trying to complete health insurance payments, you have the back offices of the health provider, you have the back office of the insurance company. They're trying to figure these things out. It can take even longer than 2 months for payments to be made. If we can just automate that, that's a great benefit to everyone, reduce a lot of cost in the system. And then these last two are just by themselves very exciting in terms of, can we build elastic and scalable systems? Not just build a system that we then have to potentially replace 5 years from now, but can we build living systems that are software-based, that will be future-proof, that will always be able to be modified with over-the-air push updates, such that as we develop new technologies and we understand how to do things better, we can dynamically adapt and have the system automatically change because everything is software-based. And then with this data advantage that with more data, we will seek to have better informed and operated systems.